Ooh, that was awesome.
Woo! What's up, guys? Welcome back to the channel. My name is Giselle and I am an ultrasound technologist. We are here with a special guest today. This is CmoneyRN Christian. He has a YouTube channel as well. So I'm going to let him introduce himself here and then we'll go on with the video.
Thanks, Giselle, for having me. Appreciate it. So, my name is Christian Cervantes. I go by CmoneyRN. I am a registered nurse here in Las Vegas, and I've been working as a RN for over 2 years now. Graduated Nevada State College back in May 2018,
Woo!
And now I'm here working full time.
Awesome,
Yep.
Awesome. Yes, and he has a YouTube channel, so if you guys want to go check that out, it's going to be in my description box below, okay? So we're going to talk about nursing versus ultrasound because a lot of times that's the one field where sonographers, you know, probably thought about going into before they do ultrasound. A lot of times we wanted to be nurses at first, or sometimes when people are straight up going into the medical field, a lot of times the nurse field is like the biggest thing that people want to do. So hopefully you guys get a lot of information out of this video. Stay tuned throughout the whole thing. We have 12 questions I'm going to ask. C-Money is going to answer about nursing. I'm going to kind of come back a little bit with ultrasound. And then in the end, he's going to give you guys some tips and advice for those of you who have no idea if you want to do nursing or ultrasound. Definitely stay tuned for that. First question, which is what type of education do you need?
Okay, so for the registered nurse path, you're going to want to go two paths. There's either you can get the associates, which is the minimum, or you could go for the bachelor's. And the thing about the two is they take the same amount of time, the same amount of education. The only difference between the BSN and ADN, the associates, is that the BSN requires a lot more research-based stuff. So you'll be learning about evidence-based practice, learning how to research, analyze articles, and look at all the research and everything behind nursing. So between the two, all you need is one or the other to become a nurse. But nowadays, I feel like hospitals, they want to encourage you to go for the higher education and get that BSN. So if you're deciding to pursue a nursing career, definitely look into the BSN. But if you don't want to do that, the associates is also just as fine as well.
Okay, so associates or bachelor's, which is the same exact thing for ultrasound. A lot of times, actually, ultrasound techs are actually associate's degrees. A lot of people think between an associate's and a bachelor's degree, like, oh, does a bachelor's get paid more? In our field, the pay grade is basically the same if you're an associate's or bachelor's. Is it the same for nursing?
The pay grade, yes, it's the same. Even if you have the associates or the bachelor's, it's the same because you're still, no matter what, are considered the registered nurse. The only difference is the level of education between the two.
Pretty much, so you guys can do associate's route or a bachelor's route as well.
Right
for
on.
Both fields, so that's good. Is there a lot of math, chemistry, and physics involved with your career?
So right off the top of my head, definitely you're going to look into math, especially statistics. You're looking at percentages and also your calculations, because when you're dealing with medications, you got to know how to calculate dosages. What's the correct dose? What's the percentage? How much do you give your patient? What is the correct range? What is the safe amount of medication you give? When it comes to physics and chemistry, you don't really have to know too much of it, but it is required part of your prerequisites. So when you're studying to become a nurse, when you're doing all the prerequisite classes, you're definitely going to take your chemistry 101. You're taking 2 parts of that. It depends on what school you're going to. You're taking your pathophysiology, your anatomy. But for the most part, math, there's not much math involved. Really, it's just all you have to do is take a basic algebra class, maybe for your prereq, and also a statistics class if you want to get into nursing. Luckily for me, you don't have to get into physics too much.
Yeah, it's actually in ultrasound, we get that question a lot too, math. I mean, I feel like you guys actually deal with more math because of the medication part of it. We definitely don't do any math at all on the daily. We have, calculators if we need to calculate the ABIs, but we use calculators for that, so I don't find myself using math. Just like nursing, we have to have math prereqs as well. I took a couple of math classes.
Yeah, I think I took the same classes as you did.
Yeah, So, I was a nursing student as well, so I kind of went through a lot of those classes you guys had to go through as well. Chemistry too, same thing for ultrasound. You just need one or two classes. Physics though, that's the big difference between I think nursing and ultrasound is in ultrasound we have to take a specific ultrasound physics class because everything that we do in ultrasound is about physics. The whole entire machine workup and how you use the machine, how you make the pictures and the images like good quality is all physics based. There's a lot of physics in ultrasound. But the class is pretty, it's intense. I don't know, did you have to take a prereq physics class?
Definitely no, I didn't have to take physics. I think the last time I took physics was in high school.
Yeah, So our physics classes, like the general physics is super hard. Like I don't even know how I survived that class.
Yeah.
But then ultrasound physics is way different. It's how to use the machine, knowledge and stuff like that. So just kind of like I always tell people, just study as much as you can, because really we just try to get through the prereqs, to be honest.
Yep.
What do you need to start working in the field? For example, like licensing, do you need to have a state license or like a national license? Like how do you become a registered nurse after you're done with school? Is there testing involved? Like what do you need really?
At the very end, when you're done with your BSN and your ADN degree, once you graduate, in order to start practicing as a registered nurse, you have to take a board exam called the NCLEX. And NCLEX is the national nursing exam that you have to take. Right now it's about 60 questions. I remember taking it was about 75 questions. And you have to take that exam, and once you do, you pass it and you're able to start practicing as an RN.
So that's just the one test you need? You don't need anything else after that?
No, that's just one exam and you're good to go. Yep.
Oh wow, okay. Say you went to school here. If you wanted to work in California, does that NCLEX work for California?
All you really have to do is you have to pass the exam in one state. So let's say, for instance, I'm taking it here in Nevada. I will get the license in Nevada, and if I wanted to practice in other states, then I would just apply for a license in a different state. The test, no matter what, is all national. It's going to be the same exact exam. You just got to go back to your state board of nursing, and then you just apply one time, and then you could practice anywhere. Just got to apply for it. Yep.
That's good. That's good. I had no idea about that. For ultrasound 2, we do take a registry board exam through ARDMS. So that's just like nursing. You can take it in any state and then also work in other states as well. But we kind of have more exams than you guys. So you take your one NCLEX exam and you're a registered nurse. We actually have to take the ultrasound SPI exam, which is a physics board exam. So you have to understand how the physics works. And then on top of that, you have to take a specialty board exam. There's multiple exams. There's abdomen, OBGYN, musculoskeletal, there's breast, pediatric. There's multiple exams that you would need to take to become specialized in that field.
That's a lot.
And each one is over $200 or something to take. I mean, you could take it multiple times if you don't pass it the first time. And our questions are over like 100 questions. So I think we do a lot more board exams in ultrasound than nursing.
But do you take all those exams at the same time?
No, so you don't take them at the same time. You want to at least make sure you specialize in one board exam.
Right.
So that just means you're competent in that field. For example, people who want to work with OBGYN clinic, they should take the OBGYN board exam. So they'll have not only the SPI board exam, which is what everyone in ultrasound should have, they're going to also have the OBGYN board exam. So they can continue on, say a year or 2 or 3 later, and do the abdominal exam, the pediatric board exam, if they want. But it just kind of depends where you work. Some places will require certain things. So for example, in my hospital, they require you to have vascular. Lots of techs don't actually have that vascular board exam. But if you want to work at my hospital, you have to have that board exam. So it's kind of like that. Like right now I have abdominal and I have vascular. And I'm currently studying for pediatric. So I already took technically 3 board exams, and I'm studying for a 4th. So that's kind of the thing with ultrasound, is you have to keep on taking exams, and it's kind of hard. But you just need one really to go and work after you graduate. A lot of times this part is really confusing for students. They have no idea how it works. So that's why we're here to help you guys.
Right on.
As a RN, what are the types of places you can work?
So the good thing about being a registered nurse is you have such a variety of places. And most of the time students, when they go into nursing, they have this idea that maybe the first place they want to work at is the hospital. But that's not the only place you can work at. You could also work at outpatient clinics. You could work at surgery centers. You could work at prisons. You can work on the planes if you want to be a flight nurse. There's so many different options you could possibly work at. You're not just constrained to just the hospital setting. You can basically go anywhere. If you want to travel around the world, definitely go for that. You could be a travel nurse, just apply for an agency, and you could go around the world depending on where they need you.
I heard there are Disney nurses. Is that true?
I don't know. So, can I apply?
In ultrasound, you guys know you can work in a hospital, an outpatient clinic, or a doctor's office, but those are pretty much the only places you can really work. There are some people who have ultrasound businesses. They'll purchase a machine and then create their own business and do that kind of stuff. I'm assuming that's a lot. I mean, I'm sure nurses can have their own businesses too.
Yeah.
What is a typical day like for you?
For sure. So a typical day, right now I actually work as an ICU nurse. I just transferred from IMC. And in case you don't know what IMC is, it's an intermediate care unit, or AKA a step down ICU unit. So basically patients that go through my unit in an IMC day to day would be patients that require critical care but are stable enough, to be discharged within the next couple of days. I transitioned from that unit and now I work on an ICU unit. And my typical day to day is I would wake up early in the morning. I show up to work maybe around 6:45, 6:50, try to get as much information about my patient, go onto the computer as possible, and then kind of just research, what type of patient I'm dealing with, what kind of medications do I decide to give during the day. And I kind of figure out what is my schedule and what's my plan of action from there. So from then on, I go into work, guns blazing. I give my medicines out to the patients. I do my head-to-toe assessments. During the day, you know, especially if you're working on a day shift, you communicate with everyone. You communicate with not just the patients, you communicate with the doctors, you communicate with the all the ultrasound technicians, the physical therapists, occupational therapists, everyone, especially family members too. So typically that's my day-to-day, just a lot of communication and also a lot of charting.
That's the one thing, nurses chart a lot.
Right.
They're always at their computer, they're always busy. Do you have your own computer, or do you like all share a computer? How does that work?
So at my hospital, I actually have my own portable WOW system, and a WOW system stands for a workstation on wheels. So imagine like a computer attached to a cart, and you're kind of just going around, kind of like when you're at a dim sum restaurant and you're just like, you know, passing around the food around. So I got my own cart. I'm typing out all my stuff. I scan medicines, but sometimes at other hospitals, a lot of their computers are actually in the rooms. So either you have it on a workstation on wheels, or you could have it in the patient's room.
I know your guys' job is hard though. I mean, you guys do a lot.
It's hard. It's definitely not easy, but also I could say the same about your job too.
That's
you know,
true.
Definitely any job in the medical field, it's not easy and it takes a lot of work. As long as you're very passionate and you love your career, you know, you're going to go very far and you're just going to enjoy doing it.
That's awesome.
Yep.
Yeah, I'm definitely not going to tell you guys about how a typical day is for me, because you guys can see all my other videos and see what it's like. But you know, to sum it all up, we just scan our patients all day, take pictures, make sure that they're okay. If they need something, I will contact the nurse. So I'll be like, let me let your nurse know, or I will let your nurse know. So we really do communicate with the nurses a whole bunch. Lots of communication. The nurses, they are seriously superstars. That's what I think.
So are the ultrasounds too.
Okay, do you deal with needles?
Needles, great question. Yes, needles. So when I think of needles, you know, sometimes the first thing that people think of is IVs. So, you know, when you deal with needles, you're putting in the IVs. And so I deal with that one. Any injections also, like intramuscular, intradermal, subcutaneous injections. We do deal with needles. And the biggest thing you also have to worry about and also be on the lookout for as a nurse is the fear of needle sticks. You know, you don't want to accidentally poke yourself, especially if you poke a patient and then you accidentally poke yourself. That is a big no-no in the hospital setting. At that point, you're going to have to go straight into the ER or go see like a health nurse. You don't want to get poked. It's not safe. Safety first. You always want to make sure you cap everything and put it in the sharps container first. Don't be throwing it away in a regular container.
Yeah. So what would you say to someone who has a fear of needles? So can they be a nurse?
That's a good question too. So I know there's people out there not just afraid of needles, but they're also afraid of the fear of blood as well. But it's just something that you kind of have to get over. I know it's kind of easier said than done, but no matter what, as a nurse, you're going to have to deal with needles on a day-to-day basis, especially with IVs, medications. You know, if it's something that you're too uncomfortable with, you know, it takes time. Maybe you can get used to it with a lot of practice, because at the end of the day, you know, you are the healthcare provider and you got to be able to do it no matter what.
There you go, you guys. You can do it.
You can do it.
And then ultrasound, we don't use needles. Well, we personally do not give IVs or insert needles. We do some procedures. Yeah. When we have the procedures, it's actually the radiologist that gives the medication, which we usually deal with lidocaine to numb up the area, because we don't do that many invasive things. But when we use, like, for example, paracentesis, thoracentesis, we do biopsies and they have to numb up the area. We use localization. And as an ultrasound technologist, we do not put any of that in. We might have to just take it and put it in the sharps container.
Nice.
That's all we do. So connecting that with the next question is, do you administer medicine? Do you give medicine?
So definitely as a nurse, you know, giving out medicine, passing meds is a big part of our jobs. We do multiple stuff. We give IV medications, or we could give like injections. We can even administer blood too. We do blood transfusions, plasma transfusions. There's so many different things that we can do. If you're into dialysis too, sometimes you have dialysis registered nurses. They also deal with the needles and also the medicines that you take. They take blood out of the patient and you replace it with clean blood.
Yeah, we definitely don't administer medicine in ultrasound.
You don't?
Nope, we don't give medicine. We always ask the nurse. We always go to the nurse and we're like, hey, your patient wants their pain meds. I mean, how many times do you get that in a day?
All the time. So when in doubt, ask your nurse. And I get that all the time.
Yep, exactly, because the nurse knows everything.
Not everything. It is a lot of responsibility, but the good thing about healthcare is that it's a big team effort. You know, luckily as a nurse, I'm not doing every single task. You know, you have your ultrasound technicians, you have your physical therapists, you have your occupational therapists. There is a different aspect of a patient's care, and it's a big team effort. So
Oh yeah.
even though it seems like I'm doing almost everything, passing the meds, all the communication, I'm not exactly doing everything because there's other stuff when it comes to taking care of the patient.
Totally true. That is
Yep.
100% true. The hospital and the medical field does not run without everybody. You need everyone to make it flow and to take care of these patients.
Exactly.
So then, will you encounter bodily fluids like blood, vomit, etc.? Because I get this question on a ton of my videos.
Yep.
So what do you think?
Yes.
As a nurse.
Yes, you're gonna see blood.
Yes, blood
So,
everywhere.
blood, vomit, poop. You know, I see it on a
Yeah.
day-to-day basis, you know, especially when you're turning patients or cleaning patients. You know, part of the job as a nurse is you're cleaning poop, and you see a lot of these bodily fluids. And of course, it's also very important too that you also take care of yourself when you're going in patients' rooms and you're especially dealing with patients that, you know, have specific diseases or infections. You're gonna want to gown up. That's when the personal protective equipment comes into play. You're wearing your gloves, you can wear safety goggles, you wear masks. Always protect yourself, because no matter what, who knows, you know, you could have poop flying at you, you could have someone throwing up right in front of your nice fig scrubs. So definitely don't want any of that, but it's just part of the job, and it's just something that you're gonna have to get used to.
That's exactly true. I mean, it is the medical field and you're gonna see it, so you kind of have to just deal with it.
Yeah.
You're gonna smell some weird smells, I promise you.
Weird smell.
Same thing with ultrasound. I mean, you will kind of see blood here and there, bodily fluids here and there, because we do procedures. We'll see bottles of fluid, like ascites and pleural effusion. We'll see bottles of fluid, but I mean, it's nothing that I think will shock us in general. You know, if you're in this field, you pretty much can handle a lot of things.
You can handle it.
Do you operate a machine on the job?
Do I operate a machine on the job?
Any types of machines? Obviously for ultrasound, you know, we do the ultrasound machine, but like, do you guys use any machines?
It depends on what specialty you are. If you're like an ICU nurse, some of the machines you get to deal with is something called a CRRT machine. I don't want to go into great detail about it because I don't know too much about it, but it's like a special dialysis machine that the registered nurse can actually run. That's a machine that we deal with. Sometimes we even have the bladder scanners if you want to, you know, scan for urine in a patient's bladder. So you have the blood pressure machine. You also have like the Doppler ultrasound machine so that you can feel pulses and all of that. So not too much equipment. When we think about machines, that's when we get the other specialties involved. I definitely don't play around with Giselle's ultrasound tech stuff. So I guess another machine too that we deal with is also the IV pumps too.
Oh yeah.
So I just thought about that.
Oh yeah, those are always beeping.
Yeah, when it's always beeping, beep, 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 beep. That's when you have people walking out of the room like, hey, your IV pump is beeping. I need the nurse.
Yeah,
So,
whenever that sound is beeping, the patients get so mad. I'm like, I'm so sorry, I need to get your nurse because I don't know what to push on those things. Have you seen that meme where like,
which one?
there's a meme which says like the hospital is the same thing as like something, I don't know, but there's just beeping noises everywhere.
Yep.
Like it's like high intense customer service and everything's beeping everywhere. I'm gonna insert that meme in here. Because it's so funny. Okay, yeah. You know, we use the ultrasound machine. And then we just use computers. We use the computers, a PACS system, to put those images from the machine into the system, and then the radiologists are going to read those. And that's pretty much how it works at most places. You really just need your ultrasound machine for ultrasound. Can you move up in this field?
Absolutely. So you could definitely move up in the field. You don't have to be, you know, just stuck as a registered nurse or a bedside nurse. You could definitely move up. There's different positions out there. And one of the things I emphasize on my YouTube channel is all the opportunities you have to practice as a registered nurse. Like for example, right now, I'm actually in the middle of a nurse practitioner program. So I'm training to become a family nurse practitioner. And as a nurse practitioner, I have the ability to prescribe medications. I could do full head-to-toe assessments. And the one cool thing that I just learned that I can actually do is I can also make medical diagnoses, which is something you can't really do as a registered nurse.
Yeah.
Like I could diagnose you as having anxiety. I could diagnose you as having hypertension. Those are things I couldn't do as a regular registered nurse. So now as a practitioner, I'm able to do that. But if that's not your fancy, there's other types of things you can move up to. You can get your master's, you can get your doctor, you could get DNP, so you could be called doctor. So if I wanted to, if I got my DNP, I could be Dr. CmoneyRN if I wanted to. You can also do other stuff. You can also be, you can go into CRNA, which is a certified nurse anesthetist, where you get to give anesthesia, which is also fun. And you could also even become a flight nurse. You get to go on planes and take care of people on planes. Does that sound pretty cool?
That's cool. What the heck? There's so much you can do with nursing.
There is so many opportunities.
Yeah, I love that so much, which is one of the reasons why I tell a lot of people if they don't want to just stick to ultrasound, because ultrasound really is just, you're just kind of just scanning patients, patient care. After that, if you want to move up, really the only thing you can do is become a lead tech, which is like in anywhere, there's always usually a lead tech who's been there for years or who knows the systems, teaches the new hires, and is in charge of everything in that office or in that department. And then there's supervisors. So you can be a supervisor of a department, so you can run the whole thing. And you usually go to the director as you know, the director is the boss of all of radiology. And then you can be a director of a department. I mean, but there's not really much to move up in ultrasound. So it's kind of a field where if you want to just go to work, do your job, and then go home, if you're happy with that, that's totally cool. But you can, I mean, maybe become a teacher or something. You'd have to do your bachelor's and then your master's, become a teacher, a professor. You can even do a business, but there's really not much movement in moving up. A lot of times people are just happy and content with where they are as scanning patients and taking care of them. So that's the one thing I really like about nursing, and I tell people all the time, if you want a lot of opportunity, a lot of different things you can do, like my mom is a charge nurse of post-op surgery. So there's that, but then you can also work like you could be a CNO, right, of a hospital, like a chief nurse officer. There's so many different things you can do with nursing. Can't really move up in ultrasound unless you want to be a leader, like a lead tech or a supervisor. That's really it.
Giselle's gonna be a lead one day.
Hopefully, I don't know, we'll see. I'm still a baby, according to some people that are in the field. They still call me a baby. You're watching a baby here grow up. And then what is the starting pay and pay in general like?
So when it comes to pay, I get this question a lot, but it really depends on where you live. So like in an impacted state like California, where the demand for nursing is even more larger than Nevada, and also the cost of living too, which you have to take into consideration, your standard average pay is gonna be a lot higher in California compared to Nevada. I can only speak of how much I'm getting paid in Nevada because this is how much I'm getting, and I want to say the average is about $30 starting as a registered nurse an hour. But definitely, I do have friends that do work as registered nurses in California. Maybe sometimes their payment could go up to like $90, $100 an hour. I'm not even exaggerating. You get paid a lot, but it's also because of the cost of living, because it's so darn expensive living in California compared to living in Nevada.
That's so true.
Yep.
Dang, I gotta move to California. That's crazy. No, in ultrasound, when you start off as a new grad, the starting pay here also kind of like he said for nursing, it just depends where you live. So in Vegas, you can usually start off around $25 an hour. If you get a registry, so like the board exams I was talking to you about, some places will actually give you a couple bucks more. And then hospitals kind of pay a little bit more in the Valley as well. So if you're working in a hospital, I'd say you could start off around $30 an hour and up even more. But I know techs who are making over $50, over $60 an hour. So it's actually pretty good for what we do.
Cha-ching.
Pretty good. Okay, last question.
All right.
Is it stressful?
Is it stressful? I'd be lying if I said it wasn't. Nursing is definitely stressful, and as is any medical profession, You work about 3 12-hour shifts a week. It's full-time. You go in and out, and there's a lot of work involved. It's not just passing medicine and assessing. You're also talking to family members. You're kind of taking care of every aspect of that patient's care. You want to make sure that they get better, and there's so much stuff involved, that people have no idea about, what you do as a registered nurse. It is stressful. There's times when, people even yell at you. There's times when people curse at you, and you can get frustrated and flustered. And also, one of the things that are realistic about nursing is something called burnout and also compassion fatigue. And it's definitely real, especially when you're working as a nurse for over, X amount of years. You're at the bedside repetitively, and you're so tired, you're fatigued, you don't get enough sleep, you don't get enough rest. And the other thing, compassion fatigue is also something that's very real too. When you're taking care of a sick patient for a very long time, you just get so jaded, you get so tired out of it. And so it is definitely real. And even though I've been working only as a nurse for 2 years, I do feel the stress, especially with, balancing a full-time job and balancing also a new educational career in nurse practitioner.
Yeah, you're going through
definitely not very stressful, but at the same time, I'm sure you can also relate to, you want to focus on your self-care, taking care of yourself, your body, going to the gym, traveling, hanging out with friends. That's the only thing that's going to be helping you at the long run, how to deal with all that stress.
Yeah, I totally agree. Everything that he said is totally true. And in one of the other videos that I recorded with another ultrasound tech, we do talk about ultrasound burnout. And this field with ultrasound is we don't have radiation. Doctors order these exams for pretty much every single reason you could possibly imagine. You come in for a headache, you get an ultrasound. You come in with pain, you get an ultrasound. You come in with swelling, you get an ultrasound. Stomach pain, anything that a patient comes in for will most likely get an ultrasound. So we're very busy in the ultrasound department, and people kind of look at us and think that we just take pictures of babies all day, and we don't really do that. I mean, if you work in an OBGYN clinic, you probably will take pictures of babies all day. But with ultrasound, we also deal with frustrated patients. I mean, we only see these patients when they get an exam ordered. We kind of hear what they're saying, and we're with them for about 30 minutes. So they tell us all these things. So that can get pretty stressful. For the most part, the job is very busy, in demand. So doctors will definitely order a lot, and we can get so stressed out because there's just so many exams coming through. I mean, in the hospital that I work at, we have at least 50 exams a day. At the outpatient clinics that I just started working at, they get over 70 patients a day. Like that's a lot to handle. So
that is a lot, yeah.
You know, it is stressful, but if you're going into the medical field, you pretty much know that you can get through it. You know, you have all of your coworkers and the people around you, your family supporting you. So always just put yourself first. You are taking care of other people, but you need to also take care of yourself.
Yeah, put yourself first, because if you can't take care of yourself, then how can you take care of other people?
But we love our jobs, obviously. Can't you tell?
We definitely love our jobs, and I do want to say that I can't do my job without ultrasound. So I have so much respect for specialties like Giselle's profession, because at the end of the day, you know, like I said, it is a team effort. Like especially when you're going in my exams, you're also doing ultrasounds of, you know, the abdomen, the legs, to see if there's any DVTs. There's so much stuff involved, and if it's not for your profession, then how am I going to be able to see and diagnose all of this different stuff? So so much respect for you.
Oh, thank you so much.
You're welcome.
I have so much respect for nurses. I mean, I was trying to be a nurse at first, and I was like, no, this is not for me. This is too stressful.
Yeah.
I actually also volunteered in a hospital, and I didn't like it either. So, I mean, maybe shadow some nurses or volunteer.
Oh, yeah.
Definitely also shadow some ultrasound techs. It's harder nowadays because of COVID, but you can, you know, when you get the chance or opportunity, I'd say definitely ask people who are in that field, ask all the questions that you need to help you choose. So do you have any tips or advice for people who are trying to decide between nursing and ultrasound?
So like what Giselle said, I think the best piece of advice I can give is kind of do your research before going into the field. I know there's a lot of times when people go into nursing, maybe like towards the last third or fourth semester, they begin to think, you know what, maybe this is not the job for, or the right career for me. So they ended up, you know, deciding to drop out and choose something else. So I would definitely do your research before going into healthcare. Weigh the pros and cons of each field. Look into ultrasound, look at physical therapy, pharmacy, doctor, nursing. Look at the pros and cons of each, and then you're gonna find the one that you're gonna fall in love with the most. And I definitely believe in, you know, shadowing if possible. Especially the good thing about, you know, you can also do is you could do volunteering, work in a hospital, and that's where you can kind of find your passion and what you want to do. So if you want to get into bedside, you want to be able to, you know, have a good career where you can kind of move up, pass medications, learn how to do assessments, then nursing by all means is there for you. If you want to, you know, go a little bit more beyond, you want to go into the medical profession, become a doctor, you can do that too. But at the end of the day, I fell in love with nursing because I like the flexibility, I like the opportunities for growth, and also the fact that, you know, I can also be able to live my own personal life while also having this work life, because I know for medical, you're basically dedicating your entire life to the profession, and that's not something I ever saw myself doing.
That's good.
Yep.
Good advice. Yeah. So definitely do your research. I really, really do want to thank you for being here and for letting everyone know about nursing. I definitely feel like nursing is tough, but if you have a passion for that, have a passion for helping others, nursing is definitely a great field. It's just something that I personally chose that wasn't for me. So, you know, and he personally chose that's for him. Definitely do your research. They're both great careers. You won't go wrong with either of them. You won't go wrong with anything in medical, I feel like.
Absolutely.
Medical will always keep growing, and we're always going to need people in the medical field.
Yep, exactly.
Yay. So thank you so much for being here, CMoney.
So
oh
much
my gosh. So you guys, I'm going to put his YouTube channel in the description box below. He is CmoneyRN. Anything else you want to tell them? Yeah,
so like Giselle said, if you're ever interested in pursuing career in nursing, definitely check out my channel where I talk about how much I love nursing, you know, what you need to know about nursing. And also if you're looking into moving up, looking into the nurse practitioner life, life. I do have a current vlog series right now where I kind of go through the day of a life of a nurse practitioner student. So just something to be on the lookout for. And I hope you guys are very much interested in medical because like Giselle said, there's always going to be a demand of medical professionals out there. You know, we need people to be in this field.
We need you guys.
We need you guys. So
you're the future.
Consider it.
Consider it. And also, you know, there are people who really like school, who really like giving back and doing a lot of different things. There are people who do nursing and then switch over to ultrasound or switch over to other things in medical.
Oh, yeah.
And then I know there's a lot of MAs that switch into ultrasound, switch into nursing. So even if you're at a different place in life, I know a girl who's going from the musical aspect of like performing and going and traveling with that kind of stuff, she's going into ultrasound. So it's never too late to change careers, switch it up. If you're already in something and you felt like nursing is calling you, it's definitely something that I suggest you guys doing because we're going to continually need nurses and ultrasound techs. It's growing. It's a growing field. So yes, thank you guys so much for being here. As always, be kind to one another, stay safe, wear your masks, stay positive. Anything else you want to say? Stay
positive. And don't forget to like, comment, and subscribe to our channels.
Subscribe to my channel, to his channel, and we'll see you guys in the next one, okay?
All right.
Bye.
Take care.